Dr. Weber, I'd like you to discuss the current role of diagnostic and treatment guidelines for cardiometabolic disorders and cardiovascular health. Lots of guidelines, right? There's the American Association of Clinical Endocrinologists, the AACE, the American College of Cardiology Foundation, the ACCF, American Diabetes Association, ADA, the American Heart Association, the AHA, and don't forget JNC7. What are the strengths and weaknesses of all of these? How do those weaknesses manifest as clinical challenges, and how can they be addressed?
There are a lot of guidelines that are put out to try and help physicians do a better job of dealing with risk factors. And we've got guidelines for diabetes, we've got guidelines for hypertension, we've got guidelines for lipid disorders. In fact, the National Institutes of Health is now sponsoring a big triple guidelines: hypertension, lipid disorders, and obesity, which will actually be a new official guideline. And they're going to try and integrate it all into one grand guideline. But you know, in the end, nothing terribly new is going to happen, because we all like to be what is known as evidence-based. Show me a clinical trial that has demonstrated that people live longer, live better, have fewer events as a result of whatever therapy you're trying to suggest I should be using. And so the new hypertension guidelines, when they come out later this year, and it's been 10 years since the last set of hypertension guidelines, will probably not be radically different. They will still talk about, let's get the blood pressure down to less than 140/90. They'll still be cautious about being more aggressive with treating hypertension, because we don't have evidence to suggest that being more aggressive actually helps people. We will see the same sort of thing with the lipid guidelines. Yes, there is pretty strong evidence that the lower the cholesterol, the better, but that's in certain patient populations. How can we be sure that everybody should have a certain level of lipid? And what about new diabetes guidelines? There has been some controversies because there's a fear that if we're too aggressive in reducing blood glucose, bringing the sugar all the way down, mightn't we be in danger of overdoing it and creating all sorts of problems for our patients? Yes, the biochemistries look terrific, but maybe we're hurting them in some other way. Even with hypertension, one of the reasons we're being cautious and saying let's not overdo it, there's some evidence now that if you punch the blood pressure down too low, you may actually start causing heart attacks and other coronary events again. There seems to be a right target. So good guidelines based on good evidence are becoming more and more important. And I like guidelines from people like the American Diabetes Association, who really think hard about these things and very responsible. The National Kidney Foundation, very thoughtful, very responsible. The hypertension guidelines from JNC8, or I think it's going to be known as JNC13 because of the year 2013. Those sorts of guidelines, the new lipid guidelines that are coming out along with the hypertension guidelines under the umbrella of the NIH, those are all going to be useful. So I think we're well positioned to continue improving our care of patients, and we're getting good help from all of these organized bodies.